and then we'll share. Can all of you see this on the screen? Just give me a head nod. Yeah? Okay, perfect. Let me move this down here. So our discussion today is on the gut-brain connection and how it ties into issues with anxiety and depression and other brain chemistry imbalances. And I want to start out with a case study. I love case studies. I have hundreds of them, and I really feel like nothing can be as influential as actually looking at the data, because data doesn't lie. You can never escape looking at an objective form of data. So let's just start out with this particular case study. And this was a client of ours who was really struggling with anxiety and depression, and we started working with him. We did his blood work, genetic testing, GI mapping, and his neurotransmitter testing. And when the results came back, we could very easily see why he was struggling with his anxiety and depression. In fact, he was in a little bit of a fight or flight type state. And as you can see here, his serotonin was high. So anything that you see here in red, it was too high. A lot of people will think that when they are having anxiety or depression, that their serotonin is always too low. And that's because that's what we've been taught by, you know, our traditional medical system. They always make it sound like it's always a serotonin issue. But what we don't realize, or what a lot of people don't realize, is that serotonin can be too high and cause much of the same type of symptomatology. In addition to that, you could have serotonin perfectly normal, but you could have other brain chemicals that are either too low or too high that, when combined with each other, can actually cause a lot of the same symptomatology. So this client here not only had high serotonin, he had high glutamate, high glycine, high histamine, and high dopamine. So it was just really compounding the issues of the way that he felt. After we had worked on him, about 6 months later, we retested the neurotransmitters. And as you can see, they had all come back into range. And the couple that went a little bit on the low end, then we just modified protocol just a little bit so that we could do some final adjustments to get those back into range. I want to do a little bit of an introduction to neurotransmitters. Many of you will hear me talk about neurotransmitters. Your neurotransmitters are your brain chemicals, and they are the chemicals that communicate information between our brain and our body. And they travel through a series of nerves called presynaptic vessels, which is, you know, at the end of the nerve. And then the chemicals go into the space between where the next nerve is, and they actually convert into an electrical impulse and then go back into the chemical once they reach the other side of the synapse. We want to have a balance of the brain chemicals right here in this area. The body will make brain chemicals and then it will break it down. And we have to look, whenever we see an imbalance or we're suspecting an imbalance in the brain chemistry, it's important that we understand that we need to have them in balance, not too high or not too low, and that we need to further understand what could be causing the overload of brain chemicals or the underproduction or having them break down too quickly. We need to look at what all the underlying causes can be. An example of a couple of different neurotransmitters that people are familiar with would be dopamine and serotonin. I want to spend a couple of minutes talking with you about these so that we can dial down a little bit more on how you can have, symptomatology, whether the brain chemical is too high or too low. Dopamine is responsible for feelings of pleasure and satisfaction, muscle control, GI issues, and even sleep patterns. If your dopamine is too low, it can give you impulsivity, cravings, like unusual cravings. You can have movement disorders, like what we see common in patients that have autism spectrum disorders, Parkinson's, Alzheimer's, things like that. But what a lot of people don't understand is that you can have a lot of the same symptoms when your dopamine is too high. It can also cause gut issues, muscle, different coordination issues, decreased ability to focus, and you can have terrible impulsivity actually if your dopamine is too high. I'll share with you really quick a Parkinson's case that I'm working on, and the client was recently diagnosed with Parkinson's based off of her symptomatology and that she has a family history of Parkinson's. So the doctor didn't do any objective testing. The doctor just diagnosed her based off of her symptoms without looking to see what was actually going on with her. Now, she may indeed have developed into Parkinson's, but what we're going to do that's very different from the traditional medical community is we're actually going to do testing to measure what the levels of like neurotransmitters are, in particular dopamine. And then we're going to dig a little deeper and find out why her body is underproducing dopamine, if it is in fact underproducing dopamine. When her test results came back, we found that in fact her dopamine levels are too high. What we don't know is, were her dopamine levels high before her doctor put her on L-Dopa? Or did the L-Dopa actually drive her dopamine levels too high? The other thing that we are taking into consideration and that we really need to understand is that when your dopamine levels are too high, it literally causes severe brain damage. It fries your brain. It's very important to have the brain chemicals in perfect balance. We don't want them too high. And so we are taking into consideration that her dopamine may have already been at a normal level or even on the high end before her doctor put her on L-Dopa. And she could have actually had some of her Parkinson's-like symptoms from some environmental toxins or infections. Upon receiving her toxicity tests back recently, we saw that she did in fact have some severe high levels of chemical toxins in her body that are known to cause Parkinson's-like effects and severe neurological damage. So what we're seeing right now is that not only does she have some really heavy toxic load of some different chemical toxins in her body that are leading to neurodegenerative damage, but her dopamine levels are also too high, also leading to more damage. So I have sent her with instructions back to her doctor to show her what these what these results are, and then she is making the decision of how she wants to proceed forward. But I can tell you that in the short time that we've been working with her, which has only been about a month, her arm has actually started moving. She reported back to us this past week that for the first time in quite a while, she noticed her arm started swinging when she was walking. We're already making progress with her, and we've only touched the surface of addressing what we feel are the underlying issues. Moving on to serotonin, we all know that serotonin is your happy hormone. In fact, a lot of your other neurotransmitters are also happy hormones as well, but serotonin is a really big player in that. Not only does it affect your mood, it does affect your sleep and your appetite as well. And if your dopamine is too low, it can give you depression, sleep issues, uncontrolled appetite, headaches, hot flashes, etc. But it can also give you a lot of those same symptoms and really make you feel completely, full of anxiety and a lot of sleep issues and some other issues if it gets too high as well. Now, I want to touch a little bit on, what does the brain have to do with the gut? And I want to start out talking about how, 5% of all neurological disease is due to genetics. A lot of people have been looking at the MTHFR gene or discovering this in doing their research because they're trying to figure out answers to why they're feeling so bad. And they'll discover this MTHFR gene and automatically think that could be their problem, and then they'll have it tested and see they have a mutation in there, and they think, oh my God, I have MTHFR. Well, everybody has MTHFR. It's a gene. If you have a mutation in that gene, it doesn't automatically mean that you're going to have problems with your brain chemistry. In fact, 95% of your issues with your health, including neurological disease, is actually due to environmental influences that could be changing the expression of your genetics. So 5% is due to genetics, where you actually cannot do anything about it. And that's a very, very small percentage. So any doctors who have told you in the past that, well, you have this gene, you're going to have this problem, 95% of the time they're wrong, because 95% of the time is due to environmental influences that we can actually change and do something about it. Sugar and refined carbohydrates are also something that can really cause a lot of damage to the brain. And in fact, it causes so much damage to the vascular flow or the blood flow through the brain that it leads to brain shrinkage. We have now coined a new term for Alzheimer's. It's called type 3 diabetes. And what people once thought was irreversible in Alzheimer's, we are seeing it reversed every single day by re-establishing the metabolism and the blood sugar metabolism of our clients and changing their diets drastically. Sugar and refined carbohydrate excessive intake not only shrinks the brain, but stress does the same thing. In fact, it is scientifically shown to shrink the gray and the white matter of the brain. It also leads to leaky brain, where the blood-brain barrier, that's what BBB means, becomes permeable, which then allows infections and other substances to cross the blood-brain barrier that would not normally be able to cross. Typically, when we have leaky gut, we also have leaky brain. In addition, infections and environmental toxins that enter through our gut, and when we have leaky gut, then they leak out of our gut, get into our bloodstream, and then cross the blood-brain barrier. They can actually also alter the brain chemistry. And this again also happens, or this directly is related to our gut biome. So our gut directly affects the brain. There have actually been studies showing where when doctors cut, when they did a partial cut of the vagal nerve, which is the nerve that goes from the gut to the brain, that a lot of symptoms actually abated. In other words, a lot of neurological symptoms actually went away. And so we are understanding more and more how the gut-brain connection is related, and how if you have an infection in the gut, it can travel via the vagal nerve up into the brain, and it can really start causing a lot of problems. There are many different variables that can affect brain chemistry balance, and we already just touched on some of them, but I kind of want to dial down a little bit on what some of these environmental toxins can be. Antibiotics and pharmaceutical drugs, including corticosteroids, also brain chemistry drugs, and a lot of other different drugs that people are commonly put on for long term, are not without their side effects. And they can actually damage the ecosystem of the gut and then start leading to a cascade of other health effects. I'm not knocking pharmaceutical drugs at all. Pharmaceuticals can save people's lives, and they do every single day. But they're designed to address acute issues. They're designed to address life or death type issues in most cases. And what has happened over the course of time is that these drugs have been substituted for lifestyle changes. And so, for example, when somebody is developing or has developed into type 2 diabetes, the doctor isn't telling them, hey, this is completely reversible and your medicine is going to be changing your lifestyle and changing your foods. The doctors don't tell a lot of people that. The doctors just say, oh, you have type 2 diabetes, here, take this metformin or take this other drug. Or in some cases, we'll see people that are taking 5 different medications for their type 2 diabetes because it's spiraled out of control. And we're able to reverse type 2 diabetes in every single case we have ever seen. Every case, there's not one case we haven't been able to reverse. In fact, we've seen even type 1 diabetes cases where we've taken people from like 60 or 70 units of insulin a day down to 6 in less than a month. And that's just by changing their lifestyle. And that's one thing that is missing in our medical model that we have today, is that doctors are putting their patients on pharmaceutical drugs for the long haul, and it's causing a cascade of effects. That's why people typically start out on one drug, and then within 3 years, they're on 2 or 3, and then within 5 years, they're on 5 to 10 different pharmaceuticals, and they're like worse off than they were before. Some other things that can also affect brain chemistry balance are genetic mutations, which I mentioned earlier are addressable 95% of the time. We can actually understand how we can change the environment or add in a very specific supplement to make that gene work properly. Foods can have a massive, massive effect on brain chemistry balance. Either it can be because the foods are toxic, because they are processed and they have chemicals and other additives that are known neurotoxins, or because they are also sprayed with pesticide. But you can also have, foods that maybe are organic or maybe considered healthy, but for that individual, they are causing massive inflammation to the brain and massive brain chemistry changes. In fact, Dr. Tori did a Facebook Live yesterday on the Modern Holistic Health Facebook page, where she talked about some genetic enzyme deficiencies that when people have them can actually cause massive changes in brain function when they are exposed to gluten or dairy. And so if you haven't seen that Facebook Live, you'll definitely want to make some time to go in and check on that. Fluoride is another known neurotoxin that we have massive exposure to in this country because our water systems, our municipal water systems, are treated with fluoride, and then a lot of people's toothpaste are also, have fluoride in them. Fluoride is a known neurotoxin. It blocks selenium receptor sites, and it can cause problems in about 79 different chemical reactions in the body, including your brain chemistry function, and your thyroid hormone conversion function, and many others. And that's why we discuss the importance of drinking reverse osmosis water and making sure that your water is purified. Stress, we already touched on that. And then there are underlying infections. That's why we do this. Another reason why we do so much testing is so that we can identify stealth infections or infections that are chronic, that you don't realize that you have, that could totally be making you sick. Here is another case study. And I wanted to share this with you. This is really, really awesome. This is a case study of a 7-year-old male whose parents brought him in because he suddenly had like this switch that turned on, and he went from being this healthy, happy, well-behaved, young man to having severe behavioral issues. In fact, they were so bad, he had super filthy mouth. He was cussing a lot. He was threatening to kill people. He was mentioning violent acts. His behavior became very deviant and unusual, and he was starting to exhibit just extreme anger. Upon his testing, we were able to see right away some high levels in his HPA. And we also there were also some cortical scans done, which if you've never seen cortical scans, the more red that shows up on the cortical scan, the more inflammation that this individual will have in their brain. And his whole brain was lit up red. So, he definitely was exhibiting what many doctors call brain on fire. The HPHPA that was high on the organic acids test was indicative of a Clostridia infection. And he also tested positive for Lyme. And just as a side note, he had a stool analysis that did not pick up the Clostridia infection. It's really important to do multiple tests so that we can cross-check on the test, because sometimes one test won't show something where another one will pick it up. He was put on a regimen to eliminate the underlying Clostridia infection, and upon eliminating the infection, this kiddo made like a 180-degree turn in his behavior. The aggression was gone, and he was just, had a really, really great outcome. And so I wanted to share this case study with you so that you can see how underlying infections can literally hijack brain function and take somebody and make them feel completely like a different person. GI health is extremely important for mental health. There is a clear association between abnormal between pathogens and cognitive behavior. Pathogens are, bacteria or viruses or parasites or any type of bug that doesn't belong in the body. Let's move on to the next one. So our gut chemistry lab, it is the main chemistry lab for a multitude of organ functions, where not only your brain chemistry is made there, including like dopamine and serotonin are the main brain chemicals that are made in the gut, but you also have thyroid hormones and many other hormones that are made there. You have there are certain vitamins that are actually made in your lower gut system, like B12. And you have so many other different, chemical compounds that are absorbed from the lower gut up into our cells. And, so everything really starts in the gut. And then we don't want to forget about genetics. And I touch a little bit more right here on when we're talking specific genetics, methyl groups are made in the gut. And so when we're talking about the MTHFR gene or any of the other methylation genes, a lot of methylation happens in the gut. And so it's really important to take an all-encompassing approach so that we can look under every stone and uncover every variable that might be causing imbalance to brain chemistry and other chemical functions in the body. We did touch a little bit on how genes can play a major role in brain chemistry. And so I'm just going to go ahead and move forward with this. But this is a huge one. And I do like to do our 55 gene panel on our clients so that we can really dial down and understand how we can optimize not only their brain chemistry, but their immune function, their detoxification abilities, and many other different engine drivers in the body. So this is another case study, and I've got another bigger shot of it on the next screen showing about how when we heal the gut and we address the gut, that we can actually make some big changes in brain chemistry. Here is a larger screenshot of this particular case study where we had a young man come in to see us. This was back, you can see here, it was actually back in 2017. He was 14 years old, and he was diagnosed at age 2 or 3 with neurosensory processing disorder. And by the time that he hit his teens, he was really exhibiting some issues with anxiety, lack of organization. He was having a little bit of agitation, some sleep issues. He was exhibiting some gut issues, and his socialization was just really decreasing. He was not wanting to be in the social setting. And his mom wasn't really noticing these changes in him. So we ran his genetics. We ran a whole series of tests but I'm going to focus in on the neurotransmitters and show you how when we started addressing his gut, his methylation, his nutrient deficiencies, because remember, you need a lot of these different nutrients to make your brain chemicals, right? And so as we started addressing all of the underlying causes that we found, you can see here how we made some really big changes. His serotonin was in the normal range, but it was on the low end of normal. We kind of want to see it more in the middle. His GABA was too low. His glutamate was too high, PA too high. His epinephrine was too high, really, leading him more into anxiety and a more fight or flight state. And his PEA was too high. We retested him 5 months later, and you can see the massive changes that we had. Yes, his serotonin, we actually did really good at getting his serotonin levels up, and getting his glycine up, and getting his GABA up, and really, really bringing these things back into range. The reason why we retest is because we need to modify and change protocols. So at this point, he was pretty much asymptomatic, meaning his symptoms were all gone. His teachers had called the mother and said, oh my gosh, we've noticed a 180 in this kid. He's just really participating in school. He's participating with his friends. And so he really made a 180. And at this point, he was feeling much better with no more symptoms. And we just modified the protocol at that time so that we could go ahead and allow these to come back into normal range. And then we just had to focus a little bit harder on the norepi to get that back up. This kiddo just graduated. And for those of you who know Stacy, she's our yoga breath therapist who's on our team. And she works with our transformation clients in the 12-month program, where our advanced genetic testing is included and yoga breath therapy is included. This is actually her son. And he just graduated from high school. And he's doing amazing. I mean, this kid just really transformed with the work that we did. Every year now, we do his neurotransmitter test and we do his blood work so that we can stay on top of him and make sure that he continues to thrive. And just so, so proud of this kiddo. Just absolutely love him. He's done an amazing job. And we made such a transformation with him that Stacy wanted to join our team. And so she is now one of our coaches on our team. And so that was the end of our presentation today. I love this quote. No one saves us but ourselves. No one can and no one way. We ourselves must take the path. And so, those of you who have joined us today, you guys are in our program, and I just want to
Zoom meeting ID 60214144869.
Not sure what happened there.
60214144869.